观众朋友，大家好，欢迎收看本期的最佳方案。在前2期的节目中，我们邀请了美国 OCuSOFT 公司的2位副总裁特洛伊·史密斯和乔治·海尼斯，给我们介绍了有关眼睑的健康的问题，让我们也了解了什么是干眼症，什么是眼睑炎，以及相关的治疗方法。那么在今天的节目中呢，我们将继续关注眼睑健康，请2位专家来谈谈白内障和螨虫的有关内容。
OCuSOFT 是美国最早从事眼睑健康产品开发生产的企业，目前已经有30年的历史。公司的系列眼睑健康产品市场占有率在美国占据第1位。
Cataract is basically a clouding of the lens that's in the inside of your eye. So normally on the eyes, the way the eye functions is that light comes into contact with the cornea. It's refracted slightly so that it goes in through the pupil, and then behind the pupil is a lens. And this lens is responsible for bending light and causing it to come into contact with the retina at precisely the right point, so that the retina can send the image via the optic nerve to the brain, and then it can be interpreted. Now, as we age, this lens becomes cloudy. And so when that lens becomes clouded, that's what's known as a cataract. Cataract is the leading cause of blindness in people over 40, and it's one of the leading causes of blindness worldwide. And so it's something that happens to everyone if you stay alive long enough. There are some causes like UV, some thought that UV rays cause cataracts, and also some injuries to the eye that can change the tissue. But it's very, very prevalent and something that everyone will have to deal with at some point in their life. Well, the surgery, in essence, replaces the natural lens in your eye with a synthetic lens. These lenses are known as intraocular lenses, and amazingly, this surgery, which at one point was a very major surgery, has become quite routine. So these lenses are foldable, and they go into a small injector, and doctors will bring patients in. They will make a very small incision. They will inject the lens into the eye, and then the whole procedure is done in about anywhere from 10 to 15 minutes. And at that point, the synthetic lens acts in much the same way that the original lens did, by refracting light right to the retina so that patients can interpret the images that their eyes are seeing. In terms of eye surgeries, making sure that the area is free of any bacteria is critically important. And so one of the things that every surgeon will do is they'll always use povidone or iodine to cleanse the surgical area. But patients can help in this process as well. And what we recommend is that patients engage in an eyelid cleansing regimen 2 weeks or a week prior to surgery. So they would use our OCuSOFT Lid Scrub Plus twice a day prior to surgery. As we discussed previously, the OCuSOFT Lid Scrub Plus not only removes any excess oil, debris, or dead skin from the eyelid, but it also kills 7 different strands of bacteria common to the ocular surface area. In addition to this, some doctors will recommend that patients spray on the hypochlorous acid, which kills all bacteria on contact, and then use the Lid Scrub Plus to remove the oil, the debris, and the dead skin. By using this regimen, it helps to ensure that the ocular surface is free from any bacteria that could get into the eye during the surgical procedure. Now, there are some concerns. Although it occurs in less than 1% of surgical cases, there is a condition known as endophthalmitis. And endophthalmitis is an inflammatory condition that occurs when bacteria gets into the inner cavity of the eye. And this condition is very dangerous and very, very serious. It can lead to, obviously you possibly could need another surgery. It could lead to the loss of the eye, and in some cases it can even lead to death. And so doctors are very, very concerned about making sure that not only their surgical instruments are cleaned prior to the surgical procedure, but also that the ocular surface itself is in tip-top shape, the best condition that it can be in prior to having the surgery.
Many of our doctors will recommend our OCuSOFT Lid Scrub Plus prior to surgery, maybe 4 to 5 days prior to surgery for patients to use, plus they'll use it in the OR prior to performing the procedures. Afterwards, patients do develop a bit of dry eye, so some of our artificial tears like retain MGD, and postoperatively, after the doctor removes the gauze and things from the eyes, then patients may use our OCuSOFT lid scrub at that point as well.
So one of the increasingly more prevalent topics in eye care, particularly in ocular surface disease, is the prevalence of Demodex mites. So Demodex mites are naturally occurring mites that most human beings have on their body. It's estimated that at any given time, a person can have upwards of 2,000 Demodex mites on their body. Now, the presence of these Demodex mites themselves is not necessarily a good thing or a bad thing. It's just something that exists. But as we age, it's possible that you can develop an infestation of Demodex mites. And this is often caused, in many cases, by the overproduction of oils like we've discussed previously. And so these Demodex mites love to eat oil, in essence. And so because our meibomian glands produce a lot of oil, the Demodex mites tend to gravitate towards our eyes and our eyelids. And what happens is there's two types of Demodex mites. So there's the Demodex brevis, which basically roam around along the lid margins, they're outside, and then the Demodex follicularum. And the follicularum are the ones that burrow into our eyelashes and our lid margins. And they basically create can create some significant problems. So as these Demodex mites burrow in, they leave what's known as cylindrical dandruff or collarettes along the lid margins, and they actually can clog the meibomian glands, which are supposed to be secreting the oil necessary to prevent dry eye, in particular evaporative dry eye. And so as these Demodex mites become more and more prevalent on the surface of our eye, the symptoms associated with dry eye become significantly worse. And so basically, in order to treat this, we recommend tea tree oil. And we have two methods of treatment for this. So in acute cases, we would recommend that patients have an in-office procedure performed.
Doctors will diagnose Demodex typically by symptoms. They can't see Demodex. There's two ways they can do it. By symptomatic diagnosis, the patients will have a collarettes at the base of the lash. So if they see those collarettes at the base of the lash, they will then assume the patient has Demodex and treat accordingly. They can epilate a lash. They can pull an eyelash, put it under a microscope, and see if the Demodex are there. The problem with lash epilation is Demodex sometimes don't hang on to those lashes, so it's hard to know either way. So many times patients become symptomatic before they're being treated for Demodex infestation.
So the in-office treatment for Demodex would begin with the patient coming to the doctor's office, the doctor observing the Demodex mites on their face, and then scheduling an appointment to have them removed in office. And what this procedure involves is our OUS Demodex swab sticks. Now, the Demodex swab stick is comprised of 50% tea tree oil, and it also has caprylic acid in it. And it's inside of a little popule like this. So it's made up of a little swab stick. The solution is contained in the bottom of the swab stick, and you have the pad on the top of the swab stick. And so doctors would sit the patient into the chair, they would pop the swab stick, the tea tree oil solution would come in, and then they would begin to scrub the patient's lid margins. And they would continue to do this until the Demodex, the tea tree oil, draws all of the Demodex mites out, and then they're removed from the surface of the eye. Now at that point, the patient has taken care of all of the Demodex mites that were currently existing, but there's still a need for the Demodex mites the eggs that the Demodex mites have been laid. And so the patient then, after the in-office treatment, would be sent home with a packet of our OUS Demodex cleanser. And so this is the take-home portion of the treatment. And this functions a lot like our Lid Scrub Plus pads. It has a surfactant, it has the tea tree oil, it also has the antibacterial properties. And patients would simply open the pad, scrub along the lid margins twice a day for 2 weeks, and then they would have completed the regimen.
听了 OCuSOFT 公司两位副总裁的介绍，让我们对白内障和眼睑的螨虫的治疗有了很多的了解。 看来 OCuSOFT 公司的确是一家美国行业历史悠久的这样的一家公司，在眼睑健康领域，他们已经研究到了很深的地步。其实我们在采访中，特洛伊史密斯副总裁呢，就像数家珍一样，向我们介绍了几十种他们公司的产品以及功效。当然，我们不可能一一的来介绍这样的产品，但是我们还是可以让观众了解 OCuSOFT 的公司在哪些领域给我们提供了专业而值得信赖的服务。
So we have a line of eyelid hygiene cleansers, we have a line of artificial tears, we have a line of supplements, we also have a line of skincare products. We have skincare products that are our Zoria line of skincare products that are available for the eyes, the eyelids, and use around those for sensitive eye patients. We have many doctors are looking to go into that direction as well to increase their practice revenue and to help patients that do have sensitive eyes and want fresher, more longer looking eyelashes and cleaner eyelids and eyebrows as well.
好，感谢 OCuSOFT 公司的2位副总裁给我们带来这么多实用的知识，也感谢观众朋友收看我们的节目。观众朋友，再会。